Welcome to the podcast, The Whole and Complete Woman, where we provide practical tips and strategies for achieving your health, wealth, and relationship goals and desires. Yes, I said desires because God does not put desires in our hearts just to tease us. So it is important to me that you are empowered with the tools and resources to not only fulfill your goals, but to create a life you love and deserve and create a legacy because the people who come after us, they are depending on us to pave the way. So I congratulate you for being here. Not only will today's content help your future self, but also those that come behind us. And that looks different for everyone, which I love. So we have Melissa Mitchell here with us today. Hello, Melissa.
Hey y'all.
I am so happy to have you here. So, Melissa is a certified doula and perinatal educator, Reiki master, and wellness warrior. Melissa is on a mission to empower women with the emotional, physical, and spiritual support they need to step into their power during this miraculous journey called womanhood. Her role extends beyond advocacy for birthing women. It's also about education, encouragement, and creating a space where her clients can have a conscious and empowered live experience. So, thank you so much for being here, Melissa. Tell me a little bit about yourself and how you got started in this journey of working with women during this really important part of their life.
Yeah, so I started out my journey as an auntie and being a part of babies' lives and wanting to see them flourish and really just loving that stage of pregnancy and the newbornhood. And I had like the baby whisperer gift. So I felt like I was really just supposed to be doing something with pregnant women. And at first I thought it was being an OBGYN, because that's, they take care of pregnant women, right? Like that's what you're typically taught. And ultimately, I was divine intervention, introduced to midwifery. And that was in 2008 after I had applied to med school, tried to get in, taken all the classes in college and all of that because I knew I wanted to be an OBGYN. And midwifery really opened me up to a way of caring for pregnant women that was much more aligned with how I felt we should be caring for them. It didn't seem like a medical emergency to me most of the time that women were pregnant. It didn't seem necessary for them to be strapped to beds and, put in situations where they're just not feeling safe and not feeling comfortable. I love the model of midwifery care, and I was like, okay, that's me. And since then, I've taken several different trainings and certifications and learning about the energetics of pregnancy, learning about womb health, learning about detoxing our bodies from you. So, those are some of the things that I've kind of picked up along the way. And I think that my path is still midwifery. And right now, I'm getting my master's of public health degree. So that's
Nice.
something that I'm like working for on the pathway to um, just being here for the community and making sure that we're taking care of our mothers so that they can take care of our families.
Yeah, that's such important work. Especially when because like not even a lot of people are always aware of what goes on in our current health system when it comes to women and giving birth and prenatal care and all of those types of things. A lot of times it's just normalized what women go through. What are some specific challenges or gaps? What are some gaps that you see that really the work that you do creates like a support system for birthing women, and how do you address these things through your work?
Yeah, a major factor in what I do is really helping women know what are the things that you're going to encounter in different birth settings. And then also helping them think about what are the things that you want to have in your birth. Because if you want to have pain medicine, if you want to have an epidural, that is your right, that's your choice. That means you're going to have to go to the hospital. because midwives are not administering epidurals. You know, you have to have an anesthesiologist, et cetera, et cetera. So just educating them on the different things that happen after you say, okay, I'm pregnant. Now what? Like, oh, I got to choose a care provider. And then you do
Yeah.
have some people who say, I don't want a care provider at all. I just want somebody to be a friend and walk with me in this journey and be at my home birth. And we're going to call it free birthing. Like, we'll deal with the aftermath and just do things how they did them for thousands of years.
For
Have babies
thousands of years,
born at
right?
home, right? Instead of
Right?
bringing them into a place where the sick and the hurt need to be helped, a hospital setting or a medical surgical setting. So I love the idea of being able to care for women in their homes with their families, educating everybody on what's happening with mom, getting everybody excited and prepared, helping them think about, okay, what do I need for the birth? What do I need for my baby? What do I need for myself? And then really encouraging them as much as I possibly can to plan for postpartum. If there's like one thing that I can say to moms, it's yes, you're going to go through this birthing process. Your body is going to go through it regardless of if you know what's happening, and you can, help it along by knowing which ways to move and stretch your body in order to expand and let the baby come through. But at the same time, like, the postpartum period is the one that stresses you out the most because you've got a new child to care for. You've got the relationship dynamics that change because there's a new being in the world.
Yeah.
And then you've got exhaustion and potentially lack of nutrition if they're not being nourished well. So really caring for mothers in that critical 40-day window postpartum is my like sweet spot. I love, because then the baby's here, we can schedule it when it feels good for you. You can get the support with breastfeeding, you can get like a Reiki energy reset, we can do yoni steams and sealing ceremonies to just kind of close off your energy after you've been so open in bringing forth a child. So it's transformative, of course, like being a mother. And I really just walk with women along all stages of that journey, because once I've seen you have a child, or once I've walked with you through that process, we friends for life, okay? I'm not going nowhere, girl. That baby's my
Yeah.
baby. That's my doula baby, okay?
Yes, yes, yes. And it's such a needed time. Everybody's taking care of mom. Once you're pregnant and whenever she decides to make that announcement, everybody's there, everybody's happy. People do the gender reveals. You've got baby showers, baby sprinkles, like all of these things. Like everybody's like preparing. Then the mom's been on this like marathon, right? Where she's carrying this baby month after month. A human being is literally growing inside of her, heart beating, lungs moving, little toes wiggling, like every single part. Creating a human being, it takes a lot of work, and it takes a lot of energy, it takes a lot of nutrients, all of those types of things. For me, with working with women in fertility and leading up to that, I like to make sure we've got your body, like the home that's going to be for this baby for 9, really 10 months, you
Mm-hmm.
know, that it's in a good place, that you have the proper nutrients, detoxification, stress management is huge for that.
Mm-hmm.
So we know, like, let's do the things prenatally, let's prepare for pregnancy, let's have a good pregnancy. But then after the mom goes to this big long marathon, has the
Mm-hmm.
baby, pushes the baby out, baby has a C-section, there's all different stories that can happen,
Yeah.
but there's a child now. A lot of times, like, everybody's like, all right, bye, you know,
Yeah.
like, or they want to come see the baby, hold the baby. What are some things that you would recommend to new moms, just as far as even like setting boundaries with her time or her energy when it comes to having a newborn?
Absolutely. So, one of the things I encourage people to do is not feel rushed to tell everybody your baby is here. Like, that's your sacred time, that's your sacred window. Nobody needs to know until you feel ready to share the news. And then you
Yeah.
can give yourself that buffer of like, okay, we're a little bit more conscious when company comes over, or we're a little bit more present with what's happening and what's going on and what we may need. But really planning to nestle with each other for that first 2 weeks. Mom should really be in the bed. So anybody who's coming over, if you wouldn't feel like having them in your bedroom, then they shouldn't be coming over. Like this is
Yeah.
not a show and tell of our new life form. That can wait. We need to give people that transition time and that chance to recover and to adjust a little bit. You're not gonna get too far in 2 weeks, but to figure out if nursing is going well, what lactation support they may need there, but to take your time in telling people and don't feel rushed to make that announcement, because then yeah, people are going to want to come over, and you can have your team already ready who are going to be cooking the food. They're going to be coming over to clean the bathrooms, because the bathrooms are going to get nasty while you're in recovery. You know what I'm saying? Like there's just a lot that happens that's so personal and so private, and you want people coming into your space really humbly there to help and to serve and to support. So if those energies are not there, it could be the mom, it could be granddaddy. Like, if the energies are not there to support the peace of your home, then
Yeah.
don't let them in. Say,
Yeah.
no, we're not accepting visitors at this time. We need time. Or if you need help, we need help. Like it can
Yeah.
go both ways. But I typically try to give people 2 weeks before I'm offering additional like supports, unless they're a doula client, and then I'm like, I need to see you within 4 days so we can get you with breastfeeding support. But for the most part, it's people need to take back their control.
Yeah.
You have control of the narrative of what's happening in your life.
Yeah, that's so important. Even I know, and I don't think I ever figured this one out, but even like leading up to having a baby, everybody's like messaging you, is the baby here yet? Is the baby here yet? Is the baby here yet? You're like, and then I'm the type, like my babies take time. They're like 41 weeks plus, and I'm going to let nature do what nature's going to do,
Mhm.
but it's like, I've even been told before you just tell people a guest date for one, but then like add 2 weeks to it so
Yeah.
that you don't even have people just, it's almost, people are like excited for you, but they don't understand, like, especially then, like, if you are in labor, you're in your birthing time, it's like getting all these messages is not helpful, and then if a woman has a traumatic birth, I've had 3 births, one in the hospital with the epidural that didn't work. And then one at home. I had a home birth. And then my last baby was a C section. And it's like, whew. I mean, I know some, women have had all kinds of births, but I will say that C section was something I was not mentally prepared for at all. I was not mentally prepared not to be able to move. Like after you have vaginal birth, you can get up, walk around, do all the things. And it was like, a very long time for me to even be able to get up out of bed. I was swollen for a long time,
Mhm.
and there was, all kinds of complications that come with C-sections. So it's like getting messages, it's like, I just need your prayers from a distance right now.
Yeah.
So I know that can be hard for mom. So I guess anyone who's just listening, just remember that if there's anyone in your life who has a baby right now and you aren't normally talking to her every single day, you know,
Now's not the time.
yeah, yeah, yeah. We know
Just
you're
wait for the
excited,
announcement.
but yeah, just wait till it's yeah. We'll let you know. We're not gonna not let you know. Okay, we're gonna let you know the baby is here. How much the baby weigh, the baby's name. 5 fingers or not 5 fingers, 10 fingers, 10 toes. All of those things. It can be very hard.
Yeah.
Let's talk a little bit though, just when it comes to things around Black maternal death and all of that, like what's going on in the hospital right now, or really what's been going on for a really long time, but just the disparity in outcomes for Black women. Talk a little bit about that.
Yeah, so the statistics have been pretty consistent that Black women are 3 to 4 times more likely to die in childbirth, and their postpartum period, which usually goes through the first year, because that's kind of that critical transformative period for the infant as well. So we count those statistics around the year after the baby's born, but really just looking at those statistics being a persistent and pervasive thing across time since we've been kind of tracking maternal and infant health. And so, if those are persistent things and they're not changing, then we need to do something different within the system. One of the initiatives that's up right now is called Earth, IRTH, because it's taking the bias out of birth. And
Mm.
really, it's a Yelp for maternal health. It's saying which facilities did you go to, which providers did you have, how were you treated? Because what we're finding and knowing and continuing to repeat is that it's racism, right? Like, people don't believe Black women when we come in and we say we're experiencing pain, or if we're able to walk and we shouldn't be able to walk because your blood pressure is so high that how are you even, we go into those moments of being like, it's a miracle you're even here, but then not believing that they're in extreme pain, that they're experiencing pulmonary embolisms after birth, that they're experiencing, blood clots and things in their body that aren't normal. Things being left inside of them after a C-section. Like, mind blowing things where we are traumatizing Black women in a negligent way and not honoring what any patient says. It shouldn't matter, if what their color
Yeah.
is. If they're coming in and they're telling you something's wrong, like, let's figure out what's wrong. Um, whether it's postpartum psychosis, or they're dealing with mental health issues and they need hormone support, or they need um, just mental health. Like, I feel like every postpartum woman, if you've had a baby, you should be in therapy. You should be trying to figure out, what does this mean to who I am? What is my identity now? How am I making sure that I'm not losing myself in being a mother? How am I setting up my network to really care for me? How am I accessing resources when I don't have a network because I moved to a new state and I just left an abusive relationship, or the multitude of things that people deal with on a regular basis? I really just would hope that we as a system can really support women mentally when they've had a child. Dads too, but for the most part, the women are
Yeah.
experiencing all of those physical changes as well as the emotional and mental ones.
In your practice in helping women, you do a lot of supportive work. What are some of the ways that you integrate emotional, physical, and spiritual support in your practice? Or do you have an example?
Yeah, absolutely. So, one of the things that has been really important to me in my journey has been breath work. And I would call that more of like a spiritual practice, but it's being mindful of your breath. It's practicing gratitude. It's tapping into your heart center. It's allowing yourself to like slow down and really connect and not feel so, the world is just kind of spinning around me and I feel out of control and I don't know what's going on and I need more sleep, and all of those kinds of things. You end up really being able to connect with yourself and say, okay, I'm okay just for today. I have everything I need to be great. Um, I can tap into, I've got like sound bowls and different methods of creating frequency so that you can feel those calming reverberations throughout your body. I study things like that. So I'll give moms a yoni steam. They're getting the natural herbs. They're helping their perineum heal postpartum. And then we'll do a sound bowl as well. So they're getting kind of that physical full body rejuvenation and reset. That's one thing
Yeah.
that I love to bring to the postpartum toolkit.
You sent me a yoni steam after my baby.
I did. I wanted to be there, like, with you, holding your
Oh.
leg and everything. I was like, let me do what I can and make sure she can steam that yoni.
Yes, 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 yes. So, what are some of the common misconceptions about doulas or even perinatal educators that you'd like to dispel?
I think some people don't realize that doulas are really there to support the whole family. I
Mm,
call myself a perinatal educator because those who trained me, Jenny Joseph and Shafia Monroe, some really powerful Black midwives in the community, told us that it's not just a pregnancy that we're concerned about caring for. We're concerned
mm,
about the whole family. Does dad have a job? Is he feeling like he can provide for his family? Is he scared about the transitions that are happening? Are they communicating well? Do they need support? Are there siblings we can include on what's happening with baby so everybody can get excited? Does mom have access to adequate care? Does she feel safe where she's living? Does she have food and water and all of those basic needs that we know are social determinants of health? And so educating on those kinds of things, it's talking about nutrition, it's talking about health and wellness, it's talking about mental health, and what's happening with your body during pregnancy and postpartum.
So, blending these things together, just what's going on in our healthcare system, and then all the things and different ways women can advocate for themselves. What are some tips that you would give women who want to advocate for themselves more effectively during pregnancy and childbirth?
I would definitely say create your birth plan. And in that birth plan, generate who you want to be with you at appointments, who you want to be with you when you're delivering, where you want to deliver, and who you want to have support you through that. But as you're generating that plan, knowing that things may shift and change, right? But at least you've got a mindset and kind of categories of being as you walk through the healthcare system, and you can feel empowered at each step to make choices because you've already looked at, okay, I'm going into this scenario. Scenario A, we get to deliver at home with a midwife. Scenario B, we have to go to the hospital for an emergency. This is what I'm going to encounter there. This is my right when I get into that space. This is how I still have autonomy over my body and I get to make decisions about what happens for me and my baby. Like really just thinking through, okay, these are the decisions that they're going to ask, and this is the way that I can prepare for that. So I'm looping back to the
Yeah.
question because I'm
Yeah. It's
forgetting
all
it in all of
connected.
my ramblings, but it's like prepare for the kind of birth that you want to have, because the kind of birth you want to have is something to prepare for.
And then them having this plan in place is like a way for them to be able to advocate for themselves because they can go in and say, this is what I'd like. I'd like to hold off on an epidural. I don't want the PIC line put in me. All of these types of things that can set you up for a series of events that ultimately can lead you down a path that you may not be your desired outcome. We don't
Exactly.
always have control of everything. Sometimes, babies do baby things,
Mhm.
inside, but having that plan in place is like a really big way for them to educate themselves or
Yeah.
advocate for themselves.
Yeah, absolutely. So, really, just as a perinatal educator, as a doula, as someone who wants to help moms with breastfeeding and all kinds of healing after they've had their baby, like the best thing you can do is have people there who can advocate for you so that you can focus on delivering your baby. Everybody in the room should know what your birth plan is and what your preferences are. And then when you have that advocate there with you, they can help speak for you when you're going through a contraction and somebody's trying to get you to sign a form and you're just like, get out of my face, like just
Yeah.
let me be, let me
Like, this is
be.
not the time for this form.
No, I don't want to
Yeah.
decline you checking my cervix again.
Yeah. Yeah.
just,
Yeah.
I just decline the checks and you'll know when I'm going to push because I'm going to start pushing.
Yeah.
Like
Yep. Yep.
eventually my body will want to push the baby out. So,
There are a lot of good OBGYNs out there. There's a lot of good midwives. There's a lot that aren't good on both sides. Um and I would say the majority of midwives are pretty good, but people sometimes don't have good experiences with them.
yeah.
When it comes to an OBGYN, because some people may still feel more comfortable going that direction,
Mhm.
what are some tips that they can do or things that they can look at in picking one who's going to really be looking out for their best interest in mind versus just trying to avoid malpractice claims, or this is just the way they do things, or maybe even they kind of like, okay, we're on the clock here, okay, like if I give you a C-section I can get home for dinner, or I've got a vacation planned, like all those types of things. And those are very real things. I'm not saying all doctors are like that, but it is a thing. You get paid more for C-sections, and they're easier because you can just plan it. You go in, do your surgery, do your thing. What are some things or even some questions that women can ask doctors as they're interviewing them? Because I just want to say this for our listeners: you're hiring this person,
Absolutely.
so you get to choose, you can fire. and you can go in whatever direction you want to go. So, as you're interviewing your doctor, what are some questions that they can ask?
I would definitely like to acknowledge that there are some fabulous OBGYNs out there. I
Oh, yes.
delivered with two fabulous OBGYNs in Minnesota. And there's just certain things that they don't do. So I wanted a water birth and they didn't. I gave up having a water birth because I wanted to work with some phenomenal Black women OBGYNs in Minnesota. Um, so I would ask, like, what kinds of births do you can ask aloud, but that's not really the word because you can birth however you want to. It's just know that some people have their preferences, and OBGYNs typically don't deliver in water. So if you are wanting that kind of birth, asking what their C-section rates are, as well as another important thing that an OBGYN should know. They should know if they're at a 20% C-section rate with their clients. Um, what else should you be asking your doctor? I think for me, what I'm getting is this sense of like trusting your gut, because you're going to have to feel safe with this person. You're going to have to trust this person's decisions for you. Do you feel like they listen to you when you come into the space, or do you feel like they're busy typing in the computer and the other person, the assistant, is doing all of the work and you're just kind of there for 10 minutes and you're gone? Um, Trust your gut and just know that if you don't feel like you're being cared for properly, if you don't feel like your decisions are being respected, if you're at your 36-week visit and they're trying to schedule an induction, like, and you're looking at them like, no, I don't. What do you mean schedule an induction? I'm fine. Like, my baby's fine. Where is this coming from? If they're giving you that feeling of fear when it comes to your pregnancy, then I'd say fire them. Like that's not okay for you to be going into a space not feeling comfortable, not feeling safe, and not feeling like you're being heard.
Yeah. Dr. Boots Taylor, he's out of Atlanta. He does not deliver anymore. He wrote a book called Shared Decision Making.
Mm,
And actually, the medical board came and took his license after he wrote that book. Yeah. So he doesn't practice anymore. He does have a midwifery clinic, and then he has an ultrasound clinic. But he's all about, it's your body. Like, this is not something to be medically managed. Pregnancy is not a disease. Okay. It is something completely natural. And you had mentioned at the beginning of this podcast that women have been birthing for thousands of years, right?
mhm,
There was a period of time when it became medically managed where women were dying in birth, and then they realized, oh, doctors should wash their hands before.
yeah.
Like, they get in there and start, helping deliver babies, and that reduced death rates drastically. I don't remember the stats right off the top of my head, but that was a
Mhm.
big thing. So
Yep,
sometimes
absolutely.
it's like some people will be like, no, women were dying in birth, but like, let's look at why. you
Hmm.
know
Absolutely.
and when those types of things were happening. um Dr. Boots Taylor is a really good one out here in Arizona. Dr. Hervey, I went and saw him after my birth because I was like, okay, I can't do that again. After my last C-section, because they overdosed me with the lumbar block. So it was quite traumatic for me. And even the surgeon who did the C-section, he was very he was more of a stoic individual.
Hmm.
But I could tell he was like sad it happened, because it was very, I think, traumatic for everyone in the room. But they didn't note it in my medical records. It just said patient tolerated, whatever, well. And so I thought when I got my medical records, I was going to get some answers, because for me, it's like, okay, well, how much did they give me so that I know next time, like, what's too much, what's
Yeah.
going on. I know genetically, like, I do process anesthesia, those things faster.
Hmm.
um, but anyways, I felt a little dismissed after what happened, or just not clear on what happened. Kind of like, whoa, that wasn't what I was expecting. When my husband came in the room, I wasn't, they had me masked up with oxygen, all of those things, and he just had to sit there and hold my hand, and I had to just lay there. And at some point I wanted to close my eyes, and then I was like, no, I can't die like this. And then in my mind I'm like, oh, is this what's happening right now? I'm like looking like, oh, this is what happens. And so it didn't feel that long to me. Maybe I did close my eyes, I don't know. But for my husband, they gave him the baby and told him, okay, she'll be done in like 20 minutes. 20 minutes went by, 30 minutes went by, 40 minutes went by, and I was still back there in the OR. So it was pretty traumatic for him as well. And I don't know what took them so long. It didn't feel that long for me. I think God was probably protecting my mind during that time.
Mhm.
But the entire experience was pretty traumatic. But the reason I'm saying this is because Dr. Hervey here, his office is like an hour from my house, and he's an OB, and he has midwives in his
Mhm.
clinic as well. That's always a good sign. Like if the OB
Yes,
has midwives in their practice, then you can say, okay, they're definitely open to you having more exercising more of your rights as a woman to give birth the way that you desire. You know, that it's not something they're
that
there for, like when there's an emergency, when it does become something that needs to be medically managed. But until then, like your body's just doing what it needs to do. And he literally sat with me and my husband for over an hour. I was just there for like I don't even know what it was called, a well visit, a planning. Like I just need to talk to someone about what's going on. And they did, you know, the regular, maybe it was a well visit, I don't know. But those are I mean, that speaks so highly of him as a doctor, you know.
yeah.
Those are the type of things you really, really want to look for. And then also, I think you really hit it on the head, like asking them what's your C-section rate? You know, what is that? They should know that right away. Um, and really even like planned versus unexpected. I'm imagine they would
If they could
have
break that
those.
down too, yeah.
Yeah, you know, are they planning out a lot of C-sections, you know? Things
Mhm.
like that. Because even now they really talk about this geriatric pregnancy. You know, I'm 40 and I've got my 1-year old here, you know. But really, as long as our bodies are healthy, you know, we're ovulating clearly, you know, and women ovulate all the way up into their 50s a lot of times.
Mhm.
Like we're able to carry a baby. Of course, you want to be healthy going into it, but just in general, like a flat rule saying, I think it's over 35 or something like that.
It's
You're
35 and up. It's not
it's
even like 34 and a half. It's like 35 and up is
and you're
geriatric.
considered geriatric. That's crazy. That is
Mhm.
crazy, crazy, crazy.
It really is. And age
So
ain't nothing but a number.
yes, ain't nothing but a number, right?
Because I'm
You know,
reverse aging right now with the things that I'm doing with my health.
me too.
So,
Me too. I had it was a couple weeks ago and it was like everywhere that I went and I was like, I'm 40, people were like, "You're 40?" And I was like, "Dang, okay." And it happened like 4 times in 1 week, like 3 or 4 times. I was like, "Yes, I'm 40. Yes, I'm a grown up." They're like, "I thought you were 27 or 32 or, you know, like just young." And it, probably too, because I've got a little baby, you know. But yeah, I'm aging
we'll keep you
backwards too.
young. Mm-hmm. We're aging backwards, love.
Yes, yes, yes. Okay, so what are your top 3 holistic wellness tips for women that are navigating pregnancy, postpartum, or just any stage of womanhood? Like, what would be your top 3 holistic tips?
Okay, so this one is more of like an awareness, but the first thing that came to my mind was know your cycle. And with that, knowing your own body. When am I going to be ovulating? When am I going to be bleeding? How can I manage my schedule around my energy levels when I'm going through that period so that I'm not stressing my body out when I'm supposed to be releasing stress, right? And just giving my womb a complete reset. So that would be tip number one. Tip number two would be like have a coach or health person or mentor or somebody who can inspire you to really stay on track with your nutrition and your hydration because that is the foundation of all of your wellness. I would add sleep in there too. Sleep is so important and we don't get enough of it, but like nutrition, hydration overall contributes so much to our wellness. Um, and then the third thing I would say is to be creative. Tap into that creative spark in your life. Tap into that what do I want to do with my day type energy. Tap into the gifts that you bring to the world and keep learning so that you can really just expand and grow.
Oh my goodness, I love all those tips. And I've noticed big differences in my own life. And we have a whole podcast episode on the 4 phases of the menstrual cycle. We actually have two that go into that. And I mean, it is powerful when you really start syncing things up with your menstrual cycle and you're like, okay, I'm in my luteal phase. We're going to be easing down here. I'm not going to do as intense exercises. Maybe I'm going to go walk. Like, oh, I'm ovulating. Like, this is a good time to record a podcast episode, you know? Like, yes,
Yes,
like
I'm gonna be
use,
glowing.
yes, glowing over here, right? So it's good to like use those hormones to our advantage and make sure they're in balance, do whatever you got to do to have that happen. But
Yeah.
really to be able to really live a more fulfilling life, because really it's a cycle, and each phase of our cycle is really beautiful when we embrace the gift of each one, whether it's rest, whether it's like tons of energy, whether being more outgoing or going more inward. So I absolutely love that tip. Water, nutrition, all that's good, and of course tapping into that creative energy. I absolutely love that.
Thank
So let me ask you a question. So, given your extensive experience as a doula, a Reiki master, and just overall like wellness warrior, what do you believe is the most important piece of advice you can offer to someone who is seeking to improve their overall well being? Like, what has been the most significant lesson you've learned on your journey?
you. I'm smiling because the first thing that came to mind, and I just try to be authentic and in the moment, is that your sexuality is sacred. Um,
Mm.
that was so convoluted and covered and wrapped up in shame and guilt and all these other emotions from other people. And when I finally like broke free from that thinking and realized like my sexuality is sacred, my sexuality is my creativity, my creative life force energy. um my sexuality is how I get desire and passion and share myself with the rest of the world, right? So like unleashing myself from all of that shame and guilt and past trauma, and really tapping into my sexuality is sacred is another level of empowerment that I didn't know I needed until I had it.
And you're
And
not
now will
even
never ever let it go.
And you're not talking about like sexual preferences. You're talking about like the energy that comes, like our sexual
Yes,
energy, and then
yes.
like the creativeness that comes to that, and like this higher vibration that you're at. Because when you orgasm, you're really at a very high vibrational state, like you're
Yes,
like, whoo, everything is good now, right?
yes.
And like, and then
Bliss.
getting into like that energy, like that bliss. Absolutely. Like when we
Mhm.
look at the emotional guidance scale, like when we're in depression, we're feeling very disempowered, like victim. Like that's not a good creative space to like figure out life, right? If we're
No.
frustrated or
Mhm.
disappointed, but when we're in that joy, bliss, freedom, like that's where like all the possibilities open.
Yes,
So
absolutely. So tap
yeah.
into that sacred sexuality and don't be afraid of it. Like, you got it. You got it.
You are opening up a
Be
whole nother can
joyful.
of worms, girl.
Go on and be joyful. The creative energy that
um,
makes babies is within
yeah.
you.
And that's so true, because so many times in my life I've had to tap back into like my body, like who I am has the power to like take a sperm and an egg and create a human being. Like all of that can be done inside of me. Like that same power created the universe, and that same power can manifest so many amazing things in our life, whether it's the relationship that we want, whether it's the career that we want, whether it's some nonprofit that you want to start that's going out and impacting men, women, children, like whatever it is, like that is that like tapping in, like to that power that's there. It's like so like it's powerful. I absolutely love it.
Yes, and I've just recently discovered Neville Goddard,
Mhm.
but mind blowing. Um, next level consciousness kinds of conversations, and he really encourages you to take time to be with you, because that's when you tap into the God in you. And so yes, that sacred sexual life force energy I'm talking about is that God in you that says, this is my mission here, this is what I'm supposed to be bringing to the earth, and these are the people I'm supposed to be impacting. And I think for myself, I'm trying to find ways to impact more and more than just my immediate, right? Like I'm trying to impact those people who are going to be here well beyond the time that I am.
Yeah.
So expanding our impact and really being a force in this world. So I appreciate all the time that you've shared with me and all the knowledge and wisdom, and how you're continuing to expand and grow and help more people. Like my cheeks are hurting. I'm so happy and excited and proud of you.
Oh, thank you so much. Well, thank you so much for being on the podcast today. I've absolutely enjoyed this conversation. I know that our listeners have enjoyed it as well. Tell us, how can people get in contact with you?
Yes, so I have a website, Sunshine Mama Doula Care, and that's mama, MAMA, .com. And I have Instagram, I have the social medias at Sunshine Mama Doula. And that's really the best way to get a hold of me, because it's got the links to my website. I have free consultation links. There are some offerings that I've been kind of giving to people word of mouth, and I need to come up with some great packages. But my practice is really looking at what do people need holistically for their wellness, and then really intuitively guiding them with resources, with herbs, with essential oils, with body work. So different like body work modalities and Reiki energy and stuff like that. So I would say the best way to get a hold of me is on the website, and my number is all over the place too.
Awesome. So we will link all of that in the show notes. So if you'd like to work with Melissa, then just go ahead and click on her links, contact her. You definitely will not be disappointed. And if you would like to hear more from our guest experts or topics on love, health, wealth, or career, then we've got you covered. Okay. So if you're watching us on YouTube, go ahead and subscribe. If you're listening on Apple Podcasts or another streaming service, go ahead and follow us. You won't regret it. And of course, as I say, it always helps us out. Okay. So it helps get the word out about the information that we're sharing. So it will help you, help us, help another woman. Okay. So please share the podcast and really just do all the things, subscribe, like, and we will be back with another episode. Thank you so much.
Peace, 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 peace.